Good morning, I am Abigail Passmore, and in addition to flying for United Airlines, I am an ALPA safety representative serving as your Director of Human Factors for ALPA's Air Safety Organization, which we refer to as the ASO. I do have the pleasure this year and honor to serve as your MC for the ALPA's 66th Air Safety Forum. And with those introductory remarks out of the way, I'd like to ask ALPA's Pilot Assistance Chair, Captain John Taylor, and his panelists to please make their way to the podium. John has assembled a terrific panel of government and industry experts to discuss health and air quality on our flight decks and in the cabin. The pandemic showed the importance of having good practices and procedures to ensure that we have a clean and sanitized aircraft.
Pilot Assistance has been working with safety since 1931. One of the premier ideals is to promote safety, not only for our public, but for ourselves. Dealing with the pandemic, it threw a wrench into the system. We had a faceless virus that destroyed our career. Ongoing, we also have certification issues, which you'll hear from Ellen Brinks later this afternoon as she does meet the doctors. There was no plan, there was no schedule on how to deal with a national pandemic that took down our airline system, not only nationally, but internationally. As airline pilots, we're used to dealing with adversity and going off checklists if we need to challenge a different task. This was a situation where we had to work across industry, across disciplines, to promote safety for the industry. I would like to introduce our panel that we all work together underneath RTCA. We have Chloe Morissetti, our principal engineer from United Airlines, Brian Moran from Boeing, and Travis Ludwig, our aeromedical chair from United. Collectively and collaboratively, we all work together to set a standard to protect our passengers, the industry, and the pilots. Chloe, I'll turn it over to you.
Good morning, everyone. My name is Chloe Shin Morsetti. I'm a lead principal engineer with the fleet engineering from United Airlines. First of all, it's my honor to be invited to this forum to speak with all of you. This is my first time joining ALPA Safety Forum. So obviously I'm a little nervous, kind of lost my train of thought. Would you please bring up my presentation?
Absolutely.
Thank you. So the reason, excuse me, the reason I'm invited to this forum, because like John mentioned, the work that we're doing with RTCA, which I will get into shortly. So Candace quizzed me before this meeting what RTCA stands for. I think most of you probably know that. And I'm glad that she quizzed me, so I'm prepared. It's radio technology. Okay, I have to use my notes, I'm sorry. Radio Technical Commission for Aeronautics. Mm-hmm. So this is an association that holds a lot of industry standards. Here we go. Before I get into the RTCA work, I'd like to talk about what United had been doing during pandemic, what process and procedure we put in together to combat this COVID-19. So, as you remember, when COVID hit, to create a safe flying environment for our passengers and our employees became more important than ever. Our industry got hit really hard. I still remember one day in April 2020, the single day passenger count went from historical in millions down to 5-digit, less than 50,000. That's something that this industry have never seen, have never experienced before. So almost on a daily, weekly basis, United, we receive many proposals, requests for products could help us to clean the airplane to keep our passengers safe. For United internally, we scramble around to see what is the best practice for us. So we quickly formed what we called a product review board. This board was led by back then senior manager Mark Peterson and co-led by me. The main focus of this team is to review all the products from technical perspective, from practical perspective. So the core team is made from fleet engineering, and we review all the products based on the script that we created. Depends on what kind of product. We look into the makeup product. We look into the ICS, the safety data sheet. We did a lot of research. A lot of things for us was new. We learned what the technology behind the product, how it works. Also, we brought in experts throughout the company for specific perspective of that product. For example, what kind of impact it will have for the material surfaces that's used in the cabin, in the cockpit. If it has some impact to the structure, we're causing any corrosion from long-term use. What kind of impact to our passengers, our employees, and people who apply these products into the airplane. And then we go through next step to do a safety risk analysis, where we have all experts coming together to evaluate all the risks and look into what kind of mitigation plan we can put together if we can bring that risk down to the minimal level. So not all the products could get past all the processes. Some could be passed on in a very early stage. But eventually, at the end, there's an evaluation and determination made if that's a good product fits in our need to be used on our airplane. If the product pass this selection, it will pass on to our business team for implementation. Over there, there's a lot of logistic things to be solved. For example, which team will be the one that's doing this job? What time frame? What frequency? Is it before departure or during airplane layover? And how to do it? So we had to create a whole procedures from head to tail for every single procedure we put in place. And of course, training. Everybody who's in the chain of working needs to get trained for the new procedures. And at the same time, our procurement is going to sourcing all those, no matter is a chemical material or is a tool to apply to it, making sure that we have enough inventory to support the process we're going to put into place. And communication. From inside company, outside company, we have a good open communication in place to inform this is new procedure coming. And in parallel, we have a different focus group that using this same method to put into procedure in place, like such as a cabin cleaning team. They focus on the cleaning methods within the cabin. as you know, there's different materials, even just around your seat, the tray table, the screen in front of you, the porch you sit on, the armrest, they're all made up from different materials. They have different reaction to the chemicals that you use. So with Boeing's help, with a lot of study, we select a most effective chemical and least impact to the environment that was using for the cabin team. And also, I want to talk about flight deck cleaning. I think that's your office, that's what you really care about. And as you know, in that little area has so many equipments and displays, buttons, switches. The methods to clean the cockpit is completely different than in cabin. We cannot get moisture get into that area. As a matter of fact, when we clean the cabin using electrostatic spray, we have to keep the cockpit door closed. And we create methods that we damp the fabric with a chemical that's selected and wipe down the panels, buttons. And also we utilize the UVC technology to sanitize the entire area. And during the SRE process, we identified there's one little trick. When cleaner comes in to clean your cockpit, there's a risk that some button switches got accidentally moved to a non-neutral position. So we create a checklist put into the cockpit. So before every departure, when pilots came in, they get this checklist checking the important buttons and switches are in the correct position so we don't accidentally deploy some flight surfaces or move the airplane, damage the airplane, or causing personal injury. So these are a lot of things that we learned throughout this process that we're trying to keep the cabin, the cockpit safe for our employees and passengers. And also in different divisions of the company, there are many, many initiatives with the same goal. For example, cargo team has their cargo action team to ensure in that area that they can get sanitized and safe for our employees, and also many other initiatives that I will get to next page. These are just some examples. When you fly United, once you get into the door, you will be handed to a sanitize, a disinfectant wipe. So there are few reasons for that. First of all, that's the wipe for you to be used. And second, the reason we hand out because that wipe has been thoroughly reviewed, approved by our PRB, and it made the least impact to the surfaces that passenger will use on. It's not on United Airlines, but happened on other airlines. Passenger came on board with a pack of a sanitized wipe. We don't know where they got from, and they wiped down their seats and discolored the whole seat. So we don't want that to happen. So we provide this tool for passengers to be used to be safe for them, safe for the airplane. And also we installed hand sanitizers throughout the airplane near the lavatory or inside the lavatory. Just like if you go into any public place, restaurant, mall, and there's always a hand sanitizer available for you to use. And as I mentioned, we chose the electrostatic spray to disinfect the cabin. And the way that the technology works is that the positive and negative elements attract to each other, so it's more evenly sprayed, and it's a finer a droplet. It gives you the best effectivity. Also, we use the microbial treatment. When we review the different products, we did our own testing. Normally, the antimicrobial effect is up to 30 days. So we tested the products with our own airplane. We chose 10 airplanes for a 30-day trial and picked the areas that been touched often. For example, the stoping, the individual ear nozzle, the armrest, lavatory door, the toilet flush button, the galley counter, and every 5 days we bacteria swap and send them the sample to the lab for analysis. And we determined our own interval is more conservative than what the manufacturer recommended. But we think that's the best decision. We think that's the good interval to ensure that these antimicrobial treatments that are effective. And also we reviewed many different type of UV products, including like a little robot go around or handheld device or something that you carry like a backpack. In the entire travel journal, there are other areas other than airplane that we worked on. I think Brian will get into more detail on that. I will now steal his thunder. So one thing I want to mention is we have a no touch check-in. So as soon as you arrive in the airport at United counter, you can finish your check-in without in contact with anybody or anything. And also we partnered with the US DoD on cabin air flow testing, also with the Boeing's support, that we use a state-of-the-art devices to capture the data inside the airplane during flight and on ground to study how the particle get to transmitted inside the airplane, how soon it gets to dumped outside the aircraft, to see the airflow pattern and how it could keep passengers safe. And last thing I want to talk about is communications. I think one of the things that United have been doing very successfully during the pandemic is a already open communication internally and externally to tell people what we are doing, why we're doing that, how we're doing it. You can see them from videos, articles, and we receive emails internally, and passengers receive emails, text messages. We have storyboards everywhere, and also at some airports, you probably have seen a HEPA filter from 787 build a stand in front of next to the customer service, and there's a barcode that if you're interested, you scan, it will tell you how the HEPA filter the air, how it keeps you safe, provide you one of the best indoor airs that you breathe in. And also, of course, social medias. You can see a lot of actions that United have been doing that leading the industry to come back for COVID-19. So now that leads to the work that we did with RTCA. So one day, the president and CEO, Terry McNee, came to me, asked me to chair the working group that they were performing SC-241 to publish a guidance document for cockpit and cabin cleaning. Since the work I've been doing, things I learned from United, I was happy to be able to share, to bring that into the group to contribute. So I happily said, yes, I will do that. And Terry said, we need this quickly because the industry needs it. I asked, how quick? He said, quick. So the end of August, we came together in a virtual meeting as our first plenary. We had about 73 members from 36 different organizations. Think of people that you never met before, all in one room, but virtual. Try to quickly work on a publication. It's not easy. It's like eating an elephant. And how do you eat an elephant? One bite at a time. But we also figured we don't have time to have the whole group work on this document one bite at a time. We have to do parallel, multiple bites at the same time. So we divided the whole team into 3 groups, and has 3 different focus. First group was led by Eva Polohakova from IATA. So this group focused on knowledge, research, review. They went out to gather all the documentations available at that time about COVID-19 to study and categorize. For 2 reasons. One, if there is already successful procedure in place, we do not need to reinvent the wheel. It could be added to the document as reference to make it a more comprehensive, useful document. And 2, we don't want to spend time on things already out there because we really have limited time to get this needed document out there. And also this team responsible for writing the structure of the document, definition, and the basic setup of how this document will be looked at. And the second team focused on chemical disinfectant materials that was led by John Taylor, the Associate Dean of ALPA. So John's team focused on all the chemicals, how they're made of, how they kill the virus, what kind of procedures that to be used for these medical chemical materials. And the third group was led by Al Adams. He's a co-founder of Avia Global, a individual contributor. This team focused on everything else that is not chemical. For example, UV technology, HEPA filter, thermal disinfectant. There's a few that ionization. So all those technologies that can be used either doing surface cleaning or air cleaning. So from the end of August till the end of December, it's about more than 120 days. The team worked really hard on this document and eventually published on Christmas. And we had 4 plenaries that everybody come together on a Teams call, a Zoom call. But the work is not just that 4 plenaries. Between those, the 3 team leaders held their own team meetings many, many times, working on their portion of the document. And it did take everyone's professionalism, dedication to get this document out quickly. Everybody had a full-time job. This is really above and beyond everybody's time. Really appreciate the hard work, the effort that everyone put in. And so 120 days, we published the document, also including our counterpart in Europe, EUROK, publication in Europe. I think that's the end of my presentation.
Thanks, Chloe.
Thank you all for listening.
The major point here, definitely. The major point here was we had a problem, and I'm still a quote from my aeromedical chair. We needed to expand our team. We had a national disaster going on, taking down the airline system, and we all came together. We were groups that had not met before. Matter of fact, this is the first time we've actually met in face. So it's kind of odd. I can tell you about their kitchens, their living rooms, and everything else. And it turns out she lives right down the road from me, and I had no idea. That is ALPA coming out to protect ourselves, our passengers, in the industry. It was a phenomenal feat. The RTCA document is the standard international cleaning document for airplanes around the world. As you mentioned, you're okay. That wouldn't have happened had we not devoted all that time. A typical RTCA document takes about 2 years. We did it in
120 days.
120 days. That's phenomenal. And Brian was also on there from Boeing. Once again, reaching out, expanding our team. Brian, you want to take it away?
Yeah, thanks. Nice job, Chloe. Thanks, John. Thanks, ALPA, for having me. I'm Brian Moran. I'm the Clean Airplane Program Leader from Boeing as part of our Confident Travel Initiative. Here today to showcase some of the information we've learned over the past 2.5 years in response to the pandemic and air travel. In March of 2020, we quickly set up an emergent team to respond to the pandemic for air travel with the mission of being a leader in the global effort to restore travel safely, effectively, and healthy, with a multi-layer of protection to prevent the virus from reaching the airplane, keep the airplane free of viruses, and minimize the transmission of viruses while on the airplane. Our goal was 3 time horizons. The first months of the pandemic were a lot of sleepless nights, a lot of unknowns because nobody knew really SARS-CoV-2, the virus that caused COVID-19, very well. What could we use to disinfect the aircraft? And then after we kind of got a hold of that, we pivoted to a little bit after a few first months to not only know what's safe to use to disinfect, but also what's effective and help standardize that guidance, not just through Boeing, but through across the industry working together. And now we're in the long-term effects. What's the step changes from the pandemic for air travel? What do passengers expect? What do flight crews expect now as a game changer that we've been through the pandemic for the future of air travel? So I'll talk about all of those this morning. Some unprecedented, amazing collaboration throughout the aviation industry and all industries. This is just a snapshot of all of the entities that work together through aviation committees, hospitals, research universities, military entities. I think it was the first time we ever talked to the CDC, helping to give information about the air quality in airplanes for wearing masks on the airplane. Some very good collaboration between the OEMs, Airbus, Embraer. We just had a meeting again with Airbus last week. We continued to share information. We're all in this together. Everybody rallied, including ALPA, just to try to figure out the best guidance, recommendations to ensure safe travel. And at Boeing, even though my part of the Confident Travel Initiative focused on the in-flight of the aircraft, we wanted to expand the approach to the entire travel journey. Passenger sentiment came back in surveys after we got information out about how good the air quality is on an aircraft. The worry was around the queue lines and the jetway and the security lines. And so we worked with airports for social distancing. We worked with the airlines to help for the self-valuation for check-ins, the temperature checks, the hand sanitizers that Chloe alluded to at airports now, and the regulatory agencies for the rules for entering and leaving, whether a test is required. We had so many meetings with so many different regulatory agencies and countries just to share information, share what we know, share our testing, a data-driven approach to help kind of restore that confidence in travel. And so my team, we did a lot of work about the cleaning and disinfecting guidance on what's safe to use for an aircraft, and I'll go over that in detail here. This chart kind of shows the solutions we've given guidance on today, and then also what we're working towards on the future. So I'll quickly walk through each of these. The chemical disinfectants, if you can recall 2.5 years ago after the pandemic started, huge demand for disinfectants. everywhere by all industries. And so we fielded questions from around the world. Can I use this disinfectant? Is it safe to use this disinfectant? We put all those disinfectants through a gamut of testing for corrosion, flammability, embrittlement, making sure that they were safe to use. We tested over 20 different disinfectants, and we gave guidance to allow the use of 9. So more disinfectants we said not to use than to use, because the chemicals in these disinfectants that are used to sanitize can also discolor, have effects on the materials that they're used on. Chloe alluded to electrostatic sprayers. This was used often by airlines, especially in the first months of the pandemic, helping to get that disinfectant across multiple areas quickly, cost efficient for the airlines. This was a huge cost impact. The pandemic was to clean an aircraft after every turn, to disinfect it and not just clean it. And electrostatic sprayers was a big part of that. Cabin airflow, Travis will talk more about that, but the best indoor space for the pandemic is actually in an aircraft. Nobody's been able to disprove that in the 2.5 years I've been saying that. The air exchange system is every 2 to 3 minutes of an aircraft through HEPA filters. Operating rooms about every 6 minutes. This room here today we're all in could be anywhere from every 12 to 30 minutes or more. But the inside of the aircraft, that air exchange system is our best combatant to the pandemic. And we were able to get that information out quickly. Antimicrobial coatings is different a little bit from chemical disinfectants. When you wipe your phone with a grocery store disinfectant you buy, it's disinfected. If the virus were to get on this remote, after I cleaned it, it's actually still there. It's an instantaneous disinfectant. But with antimicrobial coating, that coating is on the surface, and that kind of eats away the virus as it gets on it. So that's a big focus for the future. And these last for a week to 30 days, where you can put an antimicrobial coating, and several airlines now are using that on their aircraft cabins. Thermal disinfection, you can actually kill SARS-CoV-2, the virus that causes COVID-19, with heat. So we did approve the use of thermal disinfectant in the flight deck because it helps get us away from liquid and to get that surface temperature. So international planes, when they're sitting on the ground overnight, some airlines are heating up their flight decks to disinfect it. Touchless lavatory features, we enhance not just the infrared sink, but soap dispensers, toilet flush, even the door handle in some areas of the country is now hands-free. And we continue to focus on that in the future. And then UV technology is proven to effectively eliminate SARS-CoV-2. And so we developed a UV wand that airlines, including United, have used in their flight deck to disinfect it. Future solutions, this is an ongoing studies. We continue to look at the changes in air travel. What can we do to accommodate passenger and flight crew safety? We are actually developing our own antimicrobial coating in partnership with the University of Queensland in Australia. This is going through Environmental Protection Agency certification right now. This could be something we can do in the future with a 30-day, lasts for 30 days, shown to be effective after 30 days, which could be a game changer in the industry. Additional touchless features, a lot of discussion about apps today already. Potentially in the future, you could look at controlling your in-flight entertainment, your video system through your airline app that keeps hands-free from the video screen in front of you. And then also UV into the airplane safely. Can we put some sensors in the lavatory to make sure no occupants are there and do a UV scan of the lavatory sink deck, the toilet, and even maybe the door handle. Those are solutions we're working on today. We're testing some of them on our Eco Demonstrator airplane right now, and hopefully we can have more information about those in the future for implementation. And when we talked about identifying what disinfectants were safe for use, we pivoted after we got a control about what we knew was safe to also testing for what was effective. So helping to prove to the public that flying was safe, these disinfectants were working. And we did that through actual live virus testing of not only SARS-CoV-2 in a biohazard lab, but also surrogate safe virus testing on an actual aircraft with our disinfectant solutions. A lot of that was done in partnership with the University of Arizona. And Dr. Gerba, shown there in the picture, is also, his nickname is Dr. Germ. He really helped educate a lot of us on the SARS-CoV-2 virus. He helped us with our testing. He gave us a surrogate safe human virus called MS2 that we actually put on a 737 aircraft and a 787 aircraft. And it's more resistant to eliminate than SARS-CoV-2. So we knew if we were effective at eliminating MS2 that we'd be effective at eliminating SARS-CoV-2. And we did that about in the fall of 2020 and helped get that information out. So you impart the virus on tray tables, seat armrests, the lavatory bins, and then we used our disinfection methods that I just talked about. And then we would swab the area, send those back to the lab, and prove that these were effective measures at cleaning and disinfecting the aircraft. Just some pictures there of spraying of antimicrobial surface, the electrostatic sprayer, the swab of the aircraft, and the UV wand. And we had some results. We had some really good results. So with the virus, how they measure it, it's called log reduction of 1 million particles. And so our target was 99% elimination of the SARS-CoV-2 virus or the MS2 virus, depending on where we were testing. And we got really good results of even the MS2 virus, which was more resistant. Consequently, we were able to test a lot of the materials, not only in the aircraft of the MS2 virus, but also in the biohazard lab against the actual SARS-CoV-2 virus. So you'll see the results there. The first column is the disinfectant solutions. The second column is the surrogate virus. MS2 was the humanly safe virus. 2290 we also did in the lab. It's a coronavirus similar to the common cold. And then SARS-CoV-2 virus testing in the actual lab with the University of Arizona and some military entities. So the results were amazing. We've proven that we can effectively eliminate SARS-CoV-2 with the disinfectant solutions. The disinfectant wipes, the antimicrobial coatings, UV technology, the electrostatic sprayer. Didn't get us there quite on the surrogate virus, but with a wipe, that direct contact after the spray proved effective. And then also thermal disinfection, you'll see the surface temperatures there needed to get to eliminate the virus. Those proved effective as well. And then ionization, at some time in the pandemic, there was a lot of information out there on ionization. Chloe talked about it. We couldn't get ionization to actually work to the 90% level. It would remove the virus, but we couldn't get it on the aircraft to do it to the 99% virus target, so we didn't recommend it. But overall, just being able to not only telling the public that these disinfectant solutions were safe, but and also effective, kind of help restore that confidence with the flying public. So just in summary, again, we've kind of proven that you can fly during the pandemic. It's safe. The cabin and flight deck can be disinfected. The primary path of SARS-CoV-2 is aerosol. We worked with Harvard, was one of the first entities to come out to say surface transmission is not the dominant way, that it's through the air. And that's why the aircraft air quality is so important in the fight against the pandemic for air travel. Antimicrobial coatings, again, will be a focus area of the future. We're developing our own at Boeing, and hopefully we'll be able to get that out to the market here. And then on the right there, you'll see never before have we really publicly published our work at Boeing. But for the pandemic, all of our work, our testing, all these results you see they're available to the public. You can just Google Boeing Confident Travel, and you'll be able to access all these white papers with all this information. And just finally, thank you. It's been a long 2.5 years, especially the first year. But thank you to ALPA. Thank you for all the customers, the pilots, fielding the questions and just working together to help restore confidence in travel. And thankfully, we're back up to about the 2019 numbers. And it's good. My flight was full coming down here yesterday. The airport was packed. And so it's you got to get used to that again, which is a good thing. But thank you. And with that, I'll turn it back to John and go to Travis.
Brian, thank you very much. And one of the things I want to recapture, yes, please. One of the strengths we had during the RTCA working group is we focused not only on COVID, but we specifically addressed emergent pathogens, because we've had Ebola, we've had H1N1, we don't know what's going to be next. So the lessons learned can be applied for the future problems that we don't know that we might run into. And with that, ALPA not only dealt with the coronavirus, we also have the Health and Environmental Working Group that attacks a myriad of issues: potable water, sanitation, cabin air quality, sound. And Travis, you want to address that for me?
Yeah, that'd be great. First, thank the panel for being here. I thought we were going to be a team, so you guys were going to lower the bar for me, so I didn't drag us all down, but this is what I've got. Chloe, you, I think, gave me some PTSD with some of that discussion we had. I was on those phone calls with Patrick Gurin and redoing that whole process of having someone who's not flight qualified come in and clean and teach them what not to touch, and doing it in such a short period. It still gives me kind of goosebumps thinking about how much work we did in such a compressed time and how much cooperation there really was, and it was a wonderful thing. So let's get right into it. I'm going to talk a little bit today, switch gears and not focus, like John said, just on COVID-19, but that's definitely going to be a part of it. So first, let's talk a little bit about air quality. This issue, cabin air quality, has been on the radar for quite some time. Unfortunately, COVID took main stage there for a little too long. It's definitely something that is a safety of flight issue. There's not quite enough research yet to know what all it does and what it can do. There are reported effects of numbness, tingling, dizziness, brain fog, things that we don't want pilots to have while they're operating an aircraft. And we're not sure yet what those chemical substances are and how they are affecting pilots and what multiple exposures could do. So there's a lot of research still to be done in this department, and ALPA's definitely pushing hard to get that research done. Both the short and long-term effects are still needing to be done, and most importantly to our pilots, what's this going to do to their careers and what's it going to do to their medicals. As pilots, we all have medicals, and they're important to us. It's what allows us to do our job, and anything that affects that can cause a lot of stress. So this really becomes an occupational health issue that we'd like to see addressed, and we'll talk a little bit about how ALPA started to do that here in just a little bit. So one of the processes we used, were invited to, was the Airlines for America Cabin Air Quality Task Group. They had representatives from all over, both industry, the manufacturers, FAA, and labor, all invited to sit in the room, much like the RTCA group. They had 3 streams also: prevention and design, which dealt mostly with airplane designs and how to prevent air cabin quality issues. The next one is detection and measurement. There's a real problem with detection at this point. We have a built-in sensor on the front of our face, and it's evolved over the years to do a lot of good things like find food and drink coffee. It's not real good at finding noxious fumes, so they were looking into a process to find a better sensor. Lastly, mitigation, education, understanding, and communication were all very important to this process as it was kind of new that we were all recognizing what a problem this really was. So ALPA was represented on all of those work groups and then the work streams along with members and our engineering and air safety staff. That cabin air quality task force group started in mid-2018. It went all the way to the publication there in March of 2020. Utilized all the current knowledge at the time, and again, this is one of those things, much like COVID-19, constantly evolving, constantly changing, and will constantly need to be updated. That documentation, specification 126, recommended practices for addressing cabin air quality events is available online. Moving on to what ALPA has done, along with one of my air medical chair bosses there, the national chair, Ellen Brinks, helped create the fume exposure website. That's can be found at alpa.org/fume. Fume or fumes, they actually both work. I did check. Thank you, IT, for fixing that issue. We were always trying to figure out which one it was. That will provide some useful information both for a pilot who has had cabin air quality event. Some information there they can take to their medical provider to kind of bridge that gap between pilot speak and doctor speak, as Dr. Quay Snyder is so well versed in how to do that. We had to find something that we could take to emergency rooms and actually have pilots hand to the doctor so they would be able to convey in medical terms what possibly could be going on and what positions they would need to possibly look into. We also encourage you there to file ASAPs. Those are our safety reports in an IATA form. So this is the ICAO form, the standardization form. As we all hear, ALPA is a data-driven organization, and we need that safety data, and that's probably the biggest link right now that we're missing due to that detection issue. It's hard to tell when an event happens. So having that data in there, and we'll talk a little bit more about how that should look, is so important to getting this problem corrected. We did update in 2020 when the FAA came out with their information for operators, 21002, the cabin air quality education materials. And with that, it was put into Section 326 for the Authorization Act. The FAA put up a great website. I'll put a plug in for that. Definitely take some time and poke around on that website. It goes from the beginning discussions of cabin air quality, how it works, from layman's terms, and then on into kind of what the aircraft manufacturers have done, stuff that helps trade organizations like us understand what our role is in this process, and the service difficulty reporting, what the FAA has initially used for collection of this data. So as we were talking about that, this is kind of a sample documentation that we would like to see. Our first choice would always be the IATA form, but you can see in here, and I know pilots want to use it exactly. It doesn't need to be exactly like this. Most of this is taken from the IATA form. The most important part of this is it needs a lot of information. We need to know where it happened, what the throttles were doing, what phase of flight. Have you had this problem before? Did you have to divert? How bad was the smell? Things like that. One thing you'll notice as an air medical chair, I'll put a plug in here, it does not have medical information in it. That is one thing we would like to keep out of that. That is between you and your doc, and we would like to leave that out. The really only medical information there is how strong was the smell and what the descriptors were of that smell. So moving on to the huge elephant in the room there, COVID-19. That work on RTCA was really heroic. I think these folks underplayed how much work we actually did in 120 days, the amount of phone calls, the amount of documentation, the amount of research that was done, and compiling of knowledge that was available at that time and constantly changing and reviewed was really heroic. And ALPA's participation, along with everybody else's, I know, really felt like we were given to the team, all pulling the rope in the same direction, and that's to be applauded for sure. We also did a lot of work with ICAO. Dr. Quay, who I mentioned earlier, Snyder is our AMS CEO and represented ALPA in the Council Aviation Recovery Task Force. That was ICAO's version of getting a bunch of doctors together and fixing a problem, and they did a great job. They became a great outlet for early on scientific information about what the virus was, continued to tell us in ICAO to reassure their states that they could open safely and how to do that. That documentation of reopening really became the blueprint, I think, for a lot of the foreign carriers and foreign operators to operate correctly and get us all back flying internationally. And along with that, ALPA commented on a lot of the FAA documents. This would be the SAFOs that came out and some of the training stuff. And I think if there's one silver lining of COVID, if we, I am a glass half full person, I am a PA person, so warm and fuzzy. So I have to say, it really taught ALPA, I think, to reach across to our safety counterparts and training counterparts and discuss our medical issues and discuss how we integrate into the SMS system. And we all got kind of across the beach, if I can use your analogy, John. We learned we weren't in just a sandbox. We were SMEs, but we needed to know a little bit about what those guys on the other side of the ASO do, and that really, really helped us out. So moving right into that, one of the groups, at least at United, that is a co-safety and PA group is the Health and Environmental Working Group, affectionately known as the WHEG. The first meeting for the national version of that was in September of 2019. As you all know, that was just right before the slamming of the door of the pandemic. We pulled the mission statement in that first meeting. It was a great one. I won't read it there, but you can see it does have some examples of potable water, air quality, radiation, cleanliness, and some ambient noises. While air quality has taken a good portion of our time as of right now, I think that as we get on the back end of COVID-19 and we're now meeting back face to face, this work's going to pick back up, much needed. There were multiple members of the WHEG that were on the cabin air quality group for A4A. Again, our tentacles were long and wide. As anybody that asked us to come, we would send representation because we wanted to be involved in the process of fixing the problem. And lastly, as I said, that work was interrupted by COVID-19. So the crowning jewel of all this hard work was a revised paper that we put out enhancing pilots' occupational health and safety protections. This has a lot of information in it. I will say staff did a monumentous job pulling all of our ideas down in not hillbilly language like I speak, but actual foreign, real English that people can understand. So it covers air quality, potable water, food safety, all those things you saw before, and a few other like laser illumination. And it has recommendations both for our good neighbors to the north, the Canadians and their Transport Canada folks, as long as our FAA administrators on what we think might be the best possible solutions to these problems. We know we don't have all the answers, but we would like at least to start into that conversation and see if we can help and be available. That paper is open and available to the public. If anyone likes to read it, I highly recommend it. It's at alpa.org/news and events. That's all I got.
Thanks, Travis.
Thank you.
So to recap, the lessons we learned through this horrific pandemic, a career-changing event for many of us, and to be honest, it is still ongoing. This is something that's not going away. Communication, communication, communication. We worked with the FAA, Boeing, United, Airbus. At the end of the day, there were no borders, there were no isolated boxes, and as I like to say, I don't see sandboxes, I saw a beach. And everybody came together to solve the problem. And with that being said, we wanted to leave a little bit of time for questions. I'm sure that there's a few out there. It's been 3 years since we've been together. We have mics up there, and while everybody's coming up there. Chloe, you also worked on the A4A air quality as well, correct?
That's correct.
Do you have any further comments on that?
No, actually, I appreciate that page that Travis put in. That's exactly the A4A Cabin Air Quality Task Force was doing in a few different teams focused on the detection, the evaluation, and we, like John mentioned, we have team members from OEMs of airplane, OEMs of engine. We have a union, ALPA, AFA in the room. We have all operators representative in the room. Everyone work together as a whole with the same, have the same goal. There's no you or me. We're all together. So that kind of collaboration, cooperative is amazing. I think that what takes this industry to be one of the best, and then we continue going strong.
Thank you. Do we have any? Go ahead. Yes.
Thank you.
Definitely. All right. Well, we're going to go ahead and close today. We'll be around. I look forward to further discussion, and I want to thank my panel. Thanks for the work. Thanks for everything you've done, and thanks for what we will do.
Amen.